So good morning, everybody. And again, to all the essential employees out there keeping government moving, and to everyone out there, thank you for what you're doing and keeping us safe, and to the people staying at home, doing what you're doing to keep our infection rate numbers down. So thank you. But sadly, we have 4 more Albany County residents passed away from the virus. 2 of them were residents of Shaker Place. There are 2 men and a woman in their 70s and a man in his 20s that passed away. My condolences and prayers go out to the family. Our thoughts are with you at these difficult times when it's not easy to say goodbye to a loved one, to say goodbye to a son that's in his 20s, or someone in their 70s or 80s or 90s. It doesn't matter. It's still a difficult time, and my heart and prayers go out to the families that have to go through this and not be at the side of their loved one. So again, please, our hearts and prayers go out to the family and to all the other 62 families that lost people. So again, my condolences to all 66 families, and your prayers and thoughts will be with us. As of today, we have 1,398 positive cases, up 12 from yesterday. We have 889 people under mandatory quarantine. That's up 8 from yesterday. And we have 19 people under precautionary quarantine. That stays the same. We have 3,551 people have completed quarantine. Of those, 896 tested positive for the virus and have recovered. That's an increase of 29 people that recovered, which is also good news. Our hospitalization, we have 30 people in the hospital, with the hospitalization rate of 2.14% who have tested positive. That's down a little bit from the 2.23 yesterday. We have 4 people that are in our ICU. That's down 3, which is good. And the last 5-day average, yesterday was 15. We're down to 12.4 new positive cases each day. If you compare our numbers to April, it's going in the right direction. But we're also been very aggressive with our testing, and I've said this before. You know, we set up the first mobile testing sites in any county in the state of New York to go into underserved neighborhoods, so we can address that issue and continue to address that issue. But yesterday we did Queens, Ravenna, which was good, and we have other new testing sites we'll be setting up in the next couple days to address other issues in other communities. But as always, please call our mobile testing line at area code 518-465-4771, 465-4771. The full schedule for the mobile site is on our website, as always. The testing of essential workers has been expanded by New York State at UAlbany, and to the essential employees, and you know who you are, you can call 1-888-364-3065. That's 1-888-364-3065, or go online. For our colony site, as always, go to rateaid.com to sign up for that. And Priority 1 Urgent Care in Gilliland, where they're now doing the antibody testing as well. You can go there, and that number's up. I want to, right now we have a special guest today who's joining us through Zoom, and that's our New York State Attorney General, Letitia James, who's been doing an awesome job representing all New Yorkers all over the state. I don't know how she's doing it, but she's everywhere and on every issue. And her office has been investigating price gouging complaints about hand sanitizers, PPE, investigating some scams involving people pretending to be Albany and Troy police officers, trying to get money out of the innocent residents. She's called on cable companies to stop charging customers for sporting channels, because obviously we don't have sports going on right now, but reruns. And that's just a small portion of what her office has been doing, and she's really been hitting the ground running, and it's been exciting watching the energy come from that office on a variety of issues. I got to hear her speak at an ISAC convention, and I got to tell you, I thought I was getting that speech when I was over in the war zone getting ready to run out the door. It's awesome to watch the great work she's been doing as our Attorney General. And I do want to say I appreciate her time. I know it's valuable, and I want to welcome the Attorney General to say some words.
Say.
There you go. Wait, we're not hearing you. I think you muted yourself, Attorney General.
How, can you hear me now?
Yep.
Okay. Good morning. I want to thank County Executive McCoy for inviting me to join his briefing today and to speak to all of you. And I too want to join with you, County Executive, in my thoughts and in my prayers for all of those who have lost their loved ones during this crisis. I know countless number of New Yorkers are grieving this morning. And so let us pray with them. Let us, our hearts and souls all be joined all across the state of New York. And let's all remember that when we come out on the other side of this mountain, we're going to come out united and stronger than ever before. Because we are in unprecedented times in the midst of a crisis that has truly been impacting every person in our state and in our country. It knows no boundaries, no race, no ethnicity, no gender. Unfortunately, is impacting all of us. And the unfortunate reality is that no one is immune from the reaches of this virus. My office, as you know, is working remotely from home. And we've been working around the clock to meet the challenges presented by this crisis and protect communities across New York State, working 24 hours, 7 days a week. One of the criticisms or one of the unfortunate things about working from home remotely is that there are no boundaries and that individuals reach out to you at all times of the day. And it's an honor and a privilege to serve as the Attorney General because we are really in a position to help individuals, particularly those who are most vulnerable and those who are most fragile at this point in time. And over the past few weeks, we've seen scammers and predatory actors, I call them bottom feeders, and trying to prey on New Yorkers, particularly senior citizens, and trying to cheat them out of their hardworking money, and individuals who unfortunately stand in stark contrast to the courageous healthcare workers and first responders who we applaud each and every day, particularly at 7 o'clock. But we should applaud them 24 hours, 7 days a week, and it should continue. And all of those who serve us each and every day, whose names we do not know, but our hearts are joined together, who are risking their lives on the front line of this pandemic. And so I pray for them and I pray for their loved ones as well. From price gouging of essential goods to marketing and selling fake COVID treatments to scammers trying to get their hands on your stimulus checks, we've seen it all. We've seen lotions and potions and toothpaste, and you name it. Individuals who are fraudulently claiming that these are treatments for COVID-19. And family, I just want you to know that there is no cure and there is no treatment other than this trial treatment that we are focusing on, remdesivir, which is we are conducting a trial basis on that. But other than that, there is no secret lotion or potion or cure for COVID-19. So please be wary. We've sent out more than 4,000 cases of and orders of cease and desist to businesses for price gouging essential goods. What's interesting is at the beginning of this virus, we saw price gouging as it relates to hand sanitizers and masks, and now it's sort of transition. What we are seeing now is price gouging related to essential goods like eggs, food, and meat, and toilet paper, and medicine. And these goods are essential to our health and to our safety. And in New York, it's really illegal to charge grossly excessive prices for those products, which are essential for consumers. We have seen companies claiming that their creams and their supplements and their air purifiers and even toothpaste will kill this virus. This is nothing but deceptive marketing, which is illegal, but more importantly, it's dangerous to your health and to your safety. So we've ordered numerous companies to immediately stop marketing and selling these products as cure. We've reached out to online platforms to also urge them to remove these posts We've gone after scammers pretending to be from the federal government, even from the state government, and in some cases going door to door, claiming that they need information, your tax information and your personal information, in order to access your stimulus check, which is false. No elected official or government official will go door to door, and no elected official and/or government official or government agency will go door to door asking for your bank information or your personal information and/or your Social Security. We've gone after scammers that have recently targeted the Capital Region, impersonating members of the Albany and Troy Police Department to steal people's identity and money. These scams are illegal, and my office will hold anyone accountable. If anyone comes to your door claiming to represent the Capitol Police, the Troy Police Department, I urge you to reach out to your local elected officials, as well as Mr. McCoy's office as well, just to confirm that in fact they are representatives of the Albany and Troy Police Department. They would never ask for your personal information, particularly your bank information. And so we've gone after a lot of these scammers, and because we're working to really protect New Yorkers, that really is our first priority, because individuals are taking advantage of the anxiety and the fear that exists out there, and people want answers, and they want solutions, and they want cures, and they want treatment, and they want this to be over, and they want to leave their homes. I understand, but we've got to approach this from a scientific basis. We've got to do it in stages. And we've got to make sure that we've got the facts, that we know the facts, and that we not fall victim to any scammers who basically want to take hold of your hard-earned money. We've basically told debt collectors, hands off the stimulus money. The stimulus money should be used to pay your mortgage, your rent, to put food on your table. So we've told all debt collectors that they could not garnish stimulus checks, and if they do, we will take legal action. You should reach out to our office. We've called on 35 mortgage servicers in the state to provide immediate and long-term relief to New York homeowners struggling to pay mortgages right now, particularly senior citizens who have reverse mortgages. What we're seeing is an uptick in senior citizens who are having a difficult time repaying taxes, as well as interest on those reverse mortgages. And what we want to do is forestall any foreclosures that we saw during the last meltdown in our economy. We want to prevent that from happening, which is why we've been working very closely with the governor of the state of New York and crafting some of these executive orders, and also enforcing them, and working with him on a wide range of issues. We've provided support to small businesses seeking federal loans, and I've urged Congress to ensure that these loans go to small businesses, local businesses in need, and not multi-million-dollar companies. We will be monitoring that, working with the subcommittee who has oversight over PPP, because we want to make sure that these loans go to local and small businesses, because we all know that small businesses really are the lifeline of our economy, and they employ millions of New Yorkers, and it's really critically important that as we reopen the state of New York, and we do it slowly based on science and not based on politics, that we do it in a way that can help small businesses reopen their doors and help our economy as well. Lastly, let me just say that we are actively engaged in efforts to reclaim the pensions of the hardworking individuals from St. Clair. This is an issue that I'm particularly focused on because I'm concerned about individuals who rely upon their pensions, particularly now. And we are so glad, I'm so glad, that a judge granted our office the ability to access critical documents and information central to our efforts. I'm hoping we can come to some sort of resolution. We're going to continue to stand up for all of those whose pensions are on the line right now when we're struggling. These pensioners deserve full accounting of how this happened and how their life savings disappeared, and my office remains committed to getting those answers and to getting them relief. And lastly, an issue that I'm sure a number of us are all focused on, and that is nursing homes. The governor, as you know, appointed me to work with the Department of Health to ensure that there is compliance with his executive orders and the law in the state of New York. These seniors are fragile. We historically and constitutionally have a Office of Medicaid Fraud, focusing on fraud and focusing on abuse of nursing home residents. And so I urge the governor, and I want to thank him for appointing this task force to ensure that individuals, again, are separated from positive COVID residents, that there's a sufficient PPE, that staff is tested on an average basis, on a daily basis, that individuals, the loved ones of residents, are informed of really what is happening in the nursing home, and they know they can get a report on the well-being of their loved one, that the nursing home is sanitized. Again, our responsibility is to, again, investigate complaints and to inspect nursing homes consistent with the governor's executive order. And if anyone has been a victim of any of these scams and or wants to report any nursing homes, any incidents in nursing homes that we should investigate, please reach out to our office. And anyone who has witnessed any price gouging or any concerns related to this crisis, questions with respect to who's essential, who's non-essential, and any questions with respect to the reopening of our state, please reach out to our office at 1-800-771-7755. Again, that's 1-800-771-7755. And I just want to thank the County Executive McCoy for lowering the curve and doing all that he is doing, again, to keep the residents of his county safe and secure. And I thank him and I bless him. Thank you so much.
Thank you, Attorney General. And I know you can't take questions, but I do want to say New York State might be on pause. Your office is not. And you're out there protecting the people of New York, and I cannot thank you enough. And even your fight with the opiates, you came in and you grasped that issue quickly and protected all New Yorkers. So thank you from the bottom of my heart, and our prayers and thoughts are with you and the job that you're doing for New York State. So thank you.
I thank you so much, and hopefully we are also working on the opioids, and hopefully we'll be coming to a resolution, and I'll have something to report to you very soon.
Thank you. Thank you.
Thank you.
Have a good day. Dr. Whalen.
So I would also like to express appreciation for the words of the Attorney General. I think there was a lot of very good information in her remarks. And in particular, I think that it's important to stress that there is no magic bullet that can prevent you from getting COVID other than the same measures that we have been discussing from day one: hand washing, staying at home, utilizing your mask, and social distancing. If there was something else, if there was a supplement, if there was a procedure that we could recommend that would help people, we would be recommending it. I think it speaks very much to the fact that the public is frightened, and when people are frightened, they want to be able to buy something or take a recommendation that they feel will assist them. Unfortunately, there are people out there that are spreading a lot of misinformation, and this misinformation can hurt you and can cost you needless money. So it's very important to, again, know that where to get credible information on COVID and how to protect yourself and your family. And we, again, suggest that you look at our website, the state DOH website, and the CDC website. That can point you in the best direction to how to protect you and your family. So we had, as the county executive said, some bad news today in terms of our mortalities. We continue, unfortunately, to see a trend of our elderly and debilitated, and now we see a death in a younger age group as well. I think that this is something that has been seen across the country, and again reinforces the unfortunate message that no one is completely protected by virtue of their age. So people need to, again, as we talk about reopening, as we talk about coming back out to workplaces, to places where people are in the community, it's important to remember how necessary it is to prevent yourself from contracting COVID.
Thank you, Doctor. Thank you, Dr. Whalen. I appreciate it. Some just quick follow-up on the control room meeting I had yesterday at 1400. You know, obviously, we were talking about the different matrix and that we fell too behind, and we were discussing the nursing homes versus hospitals and a variety of other issues, and we'll continue to address that as we go forward. But obviously, we all knew we were not going to be able to open up by Friday, but we're hoping in the next 4 or 5 days, as we've seen that positive number go down. But as Dr. Whalen and I have said time and time again, it's there. It didn't go away. It's unfortunate, and that's why you keep telling people, even when we start to get into phase 1 and you start to reopen up, you still have to wear your mask. You have to keep social distance and cough in your arm and continue to clean your hands. Unfortunately, we had someone in their 20s. And that was the age group that I identified through our dashboard that the health department put together with my office. And I said that trend, the 20 to 29-year-olds, was just as high as the 60 to 69, and they were like trailing a little bit behind the 50 to 59-year-old. But we did drop five out of, we have 5 out of the 7. The hospitalization rate was not meeting the reopening standards, so we were addressing that issue and some other stuff. But we did get a lot of questions on what is phase 1 and phase 2 and phase 3. I'm putting some slides up, but also you can go to our website and see what it is. And I know the governor's people just put out a different list of what each phase is. But some of the clarification, phase 1 includes both residential and non-residential construction, as well as highway, street, and bridge construction. The manufacturing business includes printing and supporting the printing operations of printers reopening. And the retail trade, and I'm just giving a brief synopsis of some of it, the list is longer, and you can go on. It's delivery of curbside pickup only, which I guess business owners have to be creative. The florists, the jewelry, and luggage and shoe stores can open up in phase 1. I don't know where everyone's going to travel to, but you can get luggage if you need it. And then the wholesale trades includes clothing, furniture, home furnishing, household appliances, and that type of stuff. Agriculture and forestry and fishing include greenhouses, nurseries, and that type of stuff. So again, you can go to the website to get the full list of what is affected in phase 1. And just to quickly go over phase 2 is professional services, retail, administration, support, real estate, rental, leasing. Phase 3 is restaurants, food service is phase 3, restaurants and food service, so everyone knows. Do the math. Phase 1's 2 weeks, then you hit phase 2, and that's 2 weeks after that to hit phase 3. And I hate to say this, I predicted this right 64 days ago. I think actually 60, probably 5, the second day when I said that we probably won't open up to July or August. And I know people didn't want to hear that. It's just watching what's going on around this world. It's not that I'm a scientist. It's just looking at the numbers and how it's affecting other areas and how they're starting to reopen. Phase 4 would be arts, entertainment, recreation, and education. As you see, a variety of places already announced that they're not doing parks and recreation this summer. They're not opening pools. And churches in that fall in that area because you can still only have 10 people. In the plan that we're going to submit tomorrow to the control board about reopening, we have in there churches and other places that want to establish opening up. It's a great plan, but unfortunately there's things out of our control that we have to continue to work at to get there. But some good news, and it's hard, I'm going to get criticized online. It is hard to say there's good news when I just talked about 4 people passing away, so excuse me for the Monday morning quarterbacks. But there was a company, Nanolift, in Canada that's been watching us, what we've been doing here. They've been impressed. I want to thank them. They are an LED lighting company. The team is headquartered in Toronto, and they've been watching what we've been doing in Albany County, watching the briefings, so I appreciate that. So they want to help us, so they sent 2,000 surgical masks for us to get out to our health department to hand out to organizations who need them. So I want to say to Nanolift in Canada, thank you. You've always been a great neighbor, and I appreciate that in recognizing what we're doing here. So thank you. As always, our mental health support line is available 7 days a week, 8 a.m. to 8 p.m. at area code 518-269-6634. And our 24-hour sexual assault hotline, as always, is 518-447-7716. And the 211 number in the New York State hotline, as always. And again, to the 4 new families, my condolences, prayers, and heart go out to you. I said, everyone, please send a little prayer their way, and to all 66 families. It's a difficult time, and I feel your pain.